Hello, this is Lauriston Crockett, and you are with The Gift for Life Live. With me tonight is the pet vet, Dr. Danny Cox. Danny, how are you, buddy?
How you doing? Doing great.
Good to see you again.
Glad to be here.
And our fashionista and our rescue hero, Miss Amy, how are you?
I'm doing good.
And who do we have again?
Well, we have Penelope,
Hi, Penelope.
Queen of the Universe.
What is she wearing?
Well, she's just wearing a little pink tutu that says cutie with some bling on it. And I'm wearing my New Yorkie t-shirt that I got in New York. And we're rocking the pink and Yorkie look tonight.
I didn't get the memo. Remember, we're rocking pink tonight.
Yes, rocking the pink.
You know, guys, I want to get right to it because we've got some information that we think you need and you're going to want to hear. And it's about pet anxiety and separation anxiety. And I've had some pets that used to suffer from this. And then Dr. Danny Cox and I started working with this, creating a new protocol. And you've pretty much written a new protocol when it comes to pet anxiety and separation anxiety. And we're making some changes now using the oligopeptides found in the Gift for Life for canines and felines. So, Danny, I want to talk to you about separation anxiety and anxiety. Is it a breed issue or is it a hormonal issue?
Well, I think that for many years, I think people have thought it's breed by breed, but I think it really comes down to hormonal. There's no question that I would say it's hormonal because what I'm seeing in my patients that I put on the Gift for Life for that purpose, they're showing some remarkable results very quickly, very short term.
So we're going back to the endocrine system again that we were speaking about last week, and we know that we have an overpopulation problem, and we know we have to do a better job. So there's neutering or spaying and neutering, but if you do this, you have harmed the endocrine system. And you think about it, if these hormones are totally out of homeostasis or balance, then these animals are just a nervous wreck.
They are. A perfect example, that's Miss Penelope there. She's when her mama leaves, she is a nervous wreck. When she's away from her normal circumstances, her normal environment, she gets a little nervous. And we've had her on the Gift for Life now for a few months, and it's amazing. She's very calm, as you can see. She's used to being around people.
Right.
She does a lot of events with, where she's the spokes dog, if you will, and she's used to that. But I've seen a remarkable change in her since we've started her on the Gift for Life.
Well, you guys are always on the road in the fashion circuit, and that's another story in itself for sure. But I'd like to also reach out to a lot of our pet owners that have cats. Charlie Tuxedo, who's actually on the bottle of the Gift for Life feline, he's a rescue, and I brought him home, and he was just a mess. Remember I talked to you about him? I mean, running and hiding all day long, would come out just enough to eat. When I'd pick him up, he'd be just afraid, and I tried to hold him and tell him everything was okay. We immediately started him on the Gift for Life feline, which is a chewable treat that you give one in the morning, one in the afternoon, with or without food. It's in the shape of a heart, so we love to give our pets love. It's a liver flavor, and they absolutely love it. And within 5 days, Charlie is now out chasing our other cat, Angel, around the house, picking play fights with Max, our 103-pound dog that we have, half Labrador and half Shepherd, in the window, jumping in the bed at night to say goodnight, getting under the covers, and it's just done a complete personality change. So what do you feel about that? I mean, he was neutered at the shelter.
I think it's definitely related to hormone imbalance, and as you saw in that, I see cats too that have this wild attitude. They'll literally attack their owners and attack family members that they've lived with for years. Mm-hmm. And you put them on the Gift for Life, and there's definitely some noticeable changes. So there has to be a reason for that, and I have no other reason other than the peptide equalizes or equilibrates the immune system, the hormonal system, and which ultimately affects the immune system. And
so
the cat is in a much better position after he's...
So protocol for pet owners and protocol, I guess you would say, for other vets, is that we're finding amazing results.
I would encourage other veterinarians to look into this, to start reviewing it, do some, I'm a evidence-based practitioner. I've always looked at medicine from the standpoint of if you can prove the evidence, the science behind it, then that helps me make a decision. And I would encourage veterinarians across the country to do just that. Look into the science behind the peptide and get comfortable with it. Same thing I say about the Zutrin product that we talked about, the non-surgical neutering zinc product. Get comfortable with it. Talk to people who use it. You'll feel a lot better about it once you've done that.
When you say evidence-based, you're actually taking Genostem, the human version of this, are you not?
I am. I am, yeah.
So we have the life cycle. So everybody's on the peptides, and our pets are on the peptides. And how are you feeling?
Oh,
about
yeah,
that?
much better. I started, when I started the Genostem Pro, all I did was follow the instructions that you gave me to take one pill twice a day.
Right.
And within 30 days, I had literally lost 12 pounds without changing my diet at all. I did it that way on purpose. I didn't change how I ate, what I ate, when I ate. I live a life that's pretty stressful as far as activity. I'm always going and doing, so I grab a bite here, grab a bite there, and I literally lost 12 pounds just from that.
And what about energy?
Well, energy was amazing immediately. Within, I take two twice a day because I'm going to try to.
We're going to start training now.
Yeah, exactly, and that makes that helps to rejuvenate the body and all after you're doing that. And the biggest thing about that I've seen with that is I sleep better, I rest well, I wake up in the morning refreshed and ready to go.
Well, and so we go back to our pets that have had these elective surgeries, and some of them have, but the ones that have, and we're able to accomplish the same thing. And this is what I'm so excited about, is because, please, tell me if I'm wrong, but if the endocrine system is in homeostasis at optimal, or what we call youthful or useful levels, do we not create a longevity? Because with my personal pets and other pets, compared to, they say, the longevity of this, say a Springer Spaniel is usually 13 years old to 14 years old. My Springer Spaniel, who was inbred, by the way, I'd like to talk to you about that for a moment too. Hypothyroidism at the age of 2, which that usually happens when they've been fixed. She lived for 17 years, and love Samantha, and I miss her dearly. But so if we're talking about longevity, am I not correct that if the endocrine system is working at optimal levels, that we create longevity?
Absolutely. I mean, that's the whole point of both in humans and in pets. Our hormones are very valuable to us.
Right.
We have to have them. They're there for a reason, and we lose those by normal attrition as we age. As I said, I think last week, the sex hormones are very, very valuable to us as humans and very valuable to the pets, because as those decrease, the cells die, the energy levels are less, the rejuvenation of the body is less after exercise, and we're wasting our time thinking we're going to get that from vitamins or other supplements. These peptides make a difference because they're effectively enhancing the immune system, or I've said the immune system as a result of how it equilibrates the hormonal system that our body is so necessary. It needs it for every aspect, every body function, every physiological function in our body relates back to the functionality of the endocrine system.
Well, actually, the resignaling of the cell communication is actually taking place, is it not?
Yep.
And here's a question, and you and I haven't discussed this, so I'm going to put you on the spot.
Thanks. It wouldn't be the first time.
I know. Is there a drug, or is there another product that you have seen that does everything that the oligopeptides does with the endocrine system naturally?
No. I would say no, and I think that some of the products that I've recommended in the past, or I've looked at in the past, or I've used in the past, truly are, I think it's probably a little bit more of what we anecdotally think it's doing, more so than what it's actually doing. Because,
Right.
So the answer is no.
Okay, and one other question, and then I want to talk about some inbreeding and some other effects in here. I have a lot of customers that call me, and I know you get the same questions a lot. You and I discuss this. What is the other products that people are using for joint pain?
Well, they're using Cosiquin, they're using glucosamine, and chondroitin. They're using steroids. They're using.
Well, let's stick with the glucosamine right now, because steroids is a whole different subject because they have so many other different side effects. I think it was a whole different show we need to talk about. I know there's use for them in emergencies and stuff like that, for sure. But glucosamine. People have asked me, well, should I stay on glucosamine? And I say, no, because if you're having joint pain issues, the perfect cocktail, I call it, would be connective tissue growth factors, neural growth factors, and fibroblast growth factors. These growth factors heal on the cellular level, and they actually get rid of joint pain very quickly. So you're basically wasting your money. So again, I'm going to ask you the question is, if you had to pick the two for personal use or for pets or for also prescribing to your patients, which one would you pick?
Well, I have, in fact, started recommending the Gift for Life before I would recommend any of those other products.
Oh, thank you, Danny, because we're getting such major results. So if you're watching tonight, spread the word. Stop wasting your money. Give us a chance, and we'll get you the results, I believe, in a very short period of time, along with all the other major results that you're going to get, because Dr. Danny Cox is actually prescribing this now. Also on your pet hospitals, your mobile hospitals are going around.
We're using it on our the Shot Spot trucks here around Dallas, and we're recommending it for a lot of different conditions, and as we've spoken about, and we'll speak about more of them this tonight. Anxiety has become a real big topic. I see a lot of dogs that the only things that we have for those dogs a lot of times are actually harsh drugs, antidepressants and things like that to settle these dogs down. And this has been amazing. We have a multitude of animals, as we've talked about, at our home, and we've been giving them the Gift for Life, and it's amazing how it calms them down and settles them down when we're gone.
Gotcha. Well, that's something I want everyone to consider. And please go to thegiftforlife.com. You will find Dr. Danny Cox's page right there. You'll find out information about him. You'll find links to be able to reach out to him. If you have questions, reach out to him. He'll contact you back. You can actually get the answers. And if you're in the Dallas and the North Texas area and stuff like that, head over to the pet vet and or also look up where the shot spots are going to be, and you will get the best care there. I've seen this man do some amazing work, and I'm a big fan. I've seen you do some things. I mean, sometimes you're in a mobile mass unit and you're saving lives, and that really matters. So I just want to say thank you.
Well, thank you for that's very important to us. Amy has become very involved in animal rescue, and I mean, as you said before, we literally travel the country speaking about animal rescue, and it's very, very important for people to know that they do have places to go. And we're in fact, within the next month, we will have a hospital in McKinney that will cater to the animal rescue groups so that they have a place to go and get care, and we're going to, through her nonprofit organization, hopefully we'll be able to help them supplement the cost so they will get care and not just euthanize the pets.
Well, that's exactly what we want to do. We want to save lives. It's not these pets, it's not their fault. They don't understand. They're pure in spirit, and thank God for both you guys. I mean, I've seen you do some amazing things where other clinics would probably say, let's euthanize them and just put it at an end. But you don't. You take that extra step, and you guys do a lot. So thank you very much for what you do. I do want to talk real quickly about inbreeding, because I had an issue with my English Springer Spaniel. And when I got Samantha, she was 6 weeks old. And she was absolutely beautiful. And we started competing a little bit with her retrieving. But when she turned 2 years old, boom, hypothyroidism, allergies just came on, where we just were doing our best to try to keep up with things. The Gift for Life, we started on that at the end of her life, when I actually was able to create this peptide technology and stuff like that. But inbreeding, what are your thoughts about this? And tell me, what do you think the side effects are?
Well, inbreeding has been something that's been done for generations with breeding parents to fathers to daughters, and sons to mothers, and that's what we're talking about a lot of times when we're talking about inbreeding or related dogs, let's just say it that way. And the idea there is to get the good qualities, the good attributes, the good, try to breed out some of the things that are in a lot of these breeds. Right. And unfortunately, we end up messing with the endocrine system at the cellular level. There's so many things that go wrong. And deformities, certain cancers, certain types of cancers that are just exacerbated by keeping those things. Those are hidden. They're not out in the front. So you've got two really good dogs. You want to put those together, and you forget about the things that are hiding in the background that come out when you breed those dogs together.
Well, I'll have to call it out how I feel about it, and that's the only way I know how to. Is I've actually spoke to some breeders, and we've spoken about the side effects,
Yeah.
and they don't care. They're only worried about getting that one pup that they can turn around and sell, or try to win some competition. And most of the times that I've seen, those pets have a pretty lousy life. So I'm going to speak for myself as a gift for life. If you're a breeder, please stop. Let's start loving these animals and taking care of them. And if you're looking for a pet, rescue. Go to rescue. All my pets are rescue, and I think that's just extremely important. What is your opinion, Danny?
Well, I'm not sure that there's. A lot of the breeders are out there. It is a business, just as a lot of other things are.
Right.
But there's there's people out there with good hearts and good intentions, and really trying to provide a very good quality dog for the public. And unfortunately, sometimes they're misguided in what we just talked about, and they do some things that just like in any other business, they make mistakes. And if they're willing to attest to that, own up to that, and realize that they're the ones that make the changes. I'm all about rescue, obviously, because there's I'm going to say this every time I'm on your show. 5 million pets a year are euthanized because they don't have a home in the United States.
5 million.
5 million. And then there's another 5 million that are introduced into the population from overbreeding. Not just from breeders, but just breeding on the streets. And so spaying and neutering, neutering, those are all so important to get those numbers down. But it's a very difficult task. And but to answer your question, I think that there's some. I've got some really good friends who are breeders that have done. They listen to their veterinarians. They are conscientious. They mean.
Right.
They try very hard to do it. Is it a business? Yes, but there's a lot of them that are doing it too, Lauriston, that are they love the animals, they love the breed, and they want to perpetuate the breed, and they do a good job in a lot of those areas. But if we start with the inbreeding and we're not really thinking about the consequences, then those individuals probably they need to stop.
Right. Well, like I said, with my English Springer, who Samantha absolutely adored her, I found out after the fact that she was inbred. And so I don't know how we find this out. If there's a way to find this out, do we go through the AKC, or how do we do this?
Well, I think it'd be difficult. There's, as far as what technology and all is out there today, there's some new testing procedures to test for DNA testing, and you can match certain breeds and find out what's in those dogs, and you can even find, go drill down deep enough to find what kind of disease conditions may be a problem in those dogs' lives as they age. And we're working with a group to try and get that out to the public as quick as
So
possible.
if people reach out to you, then they can find out that information.
Yes.
And then if you give us that information also, we'll go ahead and put it up on the Gift for Life Facebook web page, and you can get this information. And please reach out to Dr. Danny Cox, and let's save some lives. That just breaks my heart to think about 5 million. I can't even comprehend. I don't think any of us can comprehend. We can do a better job. We're going to do a better job. I know we are.
I want to tell you a quick story about something that happened this last weekend. We had an event at an animal shelter, and a lady came up, walked up to us, and she had a little Chihuahua. The little Chihuahua was healthy. It was young, and she said, and one of my technicians asked the lady, she says, "Oh, are you here for vaccinations?" She says, "No, I'm here to surrender this dog to the shelter." She said, "Why? What's wrong with her?" And she said, "Well, there's nothing wrong with her except she barks too much."
She's a dog.
Exactly. So that little dog did not go into the shelter because my technician told her, you do understand that in many cases when you surrender, if there's an owner surrender due to the population issues in those shelters, they may euthanize that pet before you get back in your car. And that's horrible. And so my staff and my team are trained to understand that because, Amy talks about that a lot. And that's why we have several little dogs in our house is for that very thing.
Right.
They were going to be euthanized because they didn't have room for them, or they had conditions that were treatable, but no one would spend the money to treat them. That little dog came home with our technician. She sent me an email, said, "You now have a new Chihuahua." And I said, well, thank you very much. And so anybody that would like a new little healthy Chihuahua, we got
Reach out
one
to
for
you.
you. Call us.
But I don't understand how you can accept that little dog and bring it home and then all of a sudden just want to give it up. I've heard these stories before. I don't understand the spirit. I couldn't imagine being able to do that because once I make that commitment, but then again, this is the kind of world we live in.
Well, many people have circumstances. We all have circumstances, and there's reasons that we can't continue to take care of our pets from time to time. But what I want to stress is they need to be educated. People need to be educated to understand there's not enough space. If you take that on that commitment and you're responsible for that pet, you need to not just say, well, I just can't do it anymore.
Right.
If you can possibly, any way possible, take care of that pet, you need to do so because someone else isn't necessarily going to do it for you. And so just as this example shows, that happens every day all across this country, all over the world. Pets are euthanized because they don't have a home. And there's no reason that pets shouldn't have a home. There's enough people on this planet, and we are all stewards of God's creatures. And we should be taking responsibility to help these animals. I realize there's a lot of animals that are beyond, physical help. They can't be treated for severe injuries or disease, and we can, thankfully help remove that suffering from those individuals.
Right.
But there's a lot of them that I cannot even imagine euthanizing a dog or a cat that has done no harm to anyone except exist.
Well, thank you, Danny. I think that gives us a whole lot to think about, and I think that leads us back into our next segment with Miss Amy because you taught me something that I had no idea about. I think about shelters and adopting.
Yes.
But there's so much more that we can do together, which is called being a foster, fostering an animal. And Amy's going to tell us about what this actually means and how you can help and how I can help, and we can work together and we can save a lot more pets until we can find them a shelter or their forever home. So, Amy, please tell everyone again what you told me because it was so enlightening to me.
Well, whether it's an owner surrender or a found animal, shelters are just overrun, with population of cats and dogs. There are rescues out there that can help these animals, but they need several things. They need donations to continue the organization going on, but one of the most important things is they need fosters. And a foster is an individual or a family that will agree to accept one of these animals if the rescue tags it. I use the word tag, meaning it's a term that shelters use where a rescue has been given the authority to tag an animal, meaning they've been given permission to accept that animal as their responsibility. Rescues can do more of the tagging for these cats and dogs if they have a foster to send this animal to until it can be adopted out. So for those of you out there or you may know somebody who might not want a full-time cat or dog, or deciding if that's something you really want to add to your family, or you may be traveling a lot and you don't have time for a full-time dog, but you may be home for a month and just want to experience what it's like to have a dog or a cat in your family. You can become a foster to a rescue group in your area, and you can help save that animal's life. A lot of times these rescues, they will have certain qualifications that you need to possess or have. Each rescue is different. I can list just some basic examples. Again, this is not all rescues that will adhere to this. They may want you to not have any young children in the home or any elderly people in the home for obvious reasons. If they're going to bring a big German Shepherd to you, they don't want any small children or an elderly person where this dog may knock that individual down. They may not want you to have a chain link fence, or they may want you to have a 6-foot tall wooden fence, or again, there's just different things you can investigate with local rescues in your area. But so many more animals would be able to be saved if there were more fosters out there, where when a rescue sees an animal, a cat or a dog at a shelter that desperately needs to be saved, they'd be willing to tag that animal and accept responsibility for it. except for they need a rescue, or I mean, the rescue needs a short-term foster. It could be maybe for 48 hours. It might be for 4 months. Sometimes you never know. A lot of times also these rescues will supplement the foster for doing this. They'll provide the cat food or the dog food. They may say, we'll give you $100 a month towards the care. We'll pay for any grooming charges. We'll pay for any veterinary care. So it's not like you're doing this all out of your own pocket. And also one other thing that you need to be aware of is that a lot of times there are what we call foster fails. And that
We got a lot of those.
You agree to take on the foster for a week or two, and guess what? It turns to be for the lifetime. And those are wonderful stories. So for anybody out there who
8 of them sleep in our bed.
8?
for any of you out there who have the ability to take care of a cat or a dog, either for a short time or for a long time, please consider it. You can contact local shelters in your area. Not shelter. Well, you can contact shelters or rescues in your area. A lot of rescues are very breed specific. Like if you love Yorkies like I do, put in Yorkie rescues and find a Yorkie rescue. If you like German Shepherds, if you like poodles, if you like tuxedo cats, whatever. I assure you, there is a rescue out there who would be more than happy to have you contact them and say, listen, I want to open my home and my heart to help you save one of these animals.
That is amazing. So you know what? If you're sitting home alone tonight and you think about this, find out and reach out. And so we just make a phone call, and then they'll give us the parameters what we need.
Contact us, and I'll help you as best as I can. The need out there is staggering. That is probably one of the number one needs that rescues that have. Plus, of course, donations to help them keep the rescue going.
Right.
But the donations can come. More rescues can tag these animals if they have fosters. If they have a foster to take these animals to, that is the first thing. And then we can get donations after that, once the animal is safe and out of that shelter. That's the main thing. Get the animal out of the shelter, and then we'll figure it out from there.
Fantastic. You know what? I didn't know that. I didn't have that information. I thought it was either one or the other. Go in there and help rescue and bring them home and stuff. And so there's a lot more we can do. I'm excited about that. And I think I'd like to announce also that we're going to have Amy pick the pet of the week, and we'll start putting it up on our Facebook page. And so each week, if you're thinking about fostering or adopting, we'll be picking a rescue, and you can actually go there and be sure and check it out and reach out to them. And if you can foster, please do. If you'd like to rescue, please do. If you'd like to make a donation, please do. All of us working together, we can change a lot of lives, and we can dry a lot of tears. Danny, this has been a pretty good show.
Yeah.
I think we've covered a lot.
Good topics.
And next week, we're going to start making a major announcement about what we've been able to do and the breakthroughs that we're doing in senior pets. And a lot of people don't understand. I'm looking, when I get home at Max, he's 5 now, but I still look at him as a puppy. He gets the peptides every day. He's 103 pounds of pure muscle. My cats are too. But I was looking at some facts that you and I will all go over next week.
Okay.
Cat years, 7 years could be considered 54 years compared to a human. 10 years could be a 63-year-old compared to human years as we actually look at our pets. They suffer from what I always said, progressive aging compared to men. Dogs, 7 years, 44 to 56. 10 years, 56 to 78. How are we using the Gift for Life for canines and peptides for pet longevity and rejuvenation? And we're about to start a major campaign because of these pets. We love them. We care about their longevity. We care about the life that they're having without pain and still that brightness in the eyes and things of this nature. So we have some major announcements coming next week about senior pets and the protocol that you're using for that.
Absolutely.
She's a senior.
Penelope
Penelope will be 14 years old on June 23rd.
14.
14.
What is the average age of a Yorkie?
Well, Yorkie can be 15, 16 years or older.
Well, Penelope's going to live forever.
Yeah, Penelope has to live forever.
She's taking the gift for life.
But that's an average, and if they stay healthy. And Penelope is, we talked about last week, and we talked about her injury that she had.
Right.
She's recovered and done very well from that.
That was almost 9 years ago.
Yeah, and Penelope's had a lot of love and a lot of attention, and as have others in our household, and And throughout my practice and throughout the years of working with veterinarians around the country, we see a lot of animals like Penelope. And, you know, you talked about the aging, and one of the biggest things in aging is arthritis and changes that go on in the joints. And I'm telling you, this product is phenomenal for that. It does a great job.
Even cognitive.
And cognitive, yeah. Well, that's the thing that I think we're seeing in her is she's a little spitfire.
You a little old lady?
She still runs the show around our house, even
Oh,
with
yeah.
the Great Dane.
Yes.
That's funny. Listen, guys, we love you. Next week, we're going to have the Pet of the Week. We'll start looking at that on Facebook, The Gift for Life, Facebook Live. Please go to thegiftforlife.com. You can find out more information about this breakthrough technology that's natural. It's highly effective and fast acting. You can find out more information how to contact Dr. Danny Cox and reach out to him. And listen, this is A Gift for Life Live. We'll see you next week. We love you guys.